moderating today. And our topic today is telehealth. We all know about telehealth. The landscape's changing super quickly. Some of the big wigs of the major hospital systems like HCA and Kaiser Permanente are anticipating 20 to 30% of all patient visits will be telehealth by 2030. And the space is changing. You may have heard whispers about, funding winters and things like that for startups, but really there's tons of players in the space, from large companies like Sword Health, even down to other startups like Recovery One, and even the always present growth of those major hospital systems like Kaiser Permanente, who are late adopters but looking to grow into the space. And a lot of questions I've gotten recently over the last few months has been, how do I get into telehealth? So I'm really excited to introduce you guys today to our clinical experts. We'll start with Megan. Why don't you guys each introduce yourself really quickly and we can get started.
Hi, my name is Megan Taff. I've been a PT for about 20 years, mainly working in outpatient ortho sports injury, but I've been in the virtual telehealth space for about 4 years now. Happy to be here.
Thanks. And Kiara?
Hi, my name is Kiara. I also go by Kiki. I have been a recruiter for the startup Adventures World since 2020. So I've recruited for Uno, Kaya Health, and K Health. And I'm also happy to be here.
Awesome. Thank you. James?
Hey everyone, James Maska. I'm a training and enablement lead at Sword Health. But if anyone asks what I do, I always say physical therapist first, and probably always will. Been a PT since 2014. Worked all over the country as a traveling physical therapist for about 5 years. And then I helped start a clinic here in Buffalo, New York for refugees, low-income residents of the city. And then found Sword Health by accident in the middle of the pandemic and been here ever since.
Awesome. And last but not least, UC.
Hi, everyone. I'm UC. I'm a pelvic health PT or physio, as you like to call it. I have been in the academic space and entrepreneur space, but most notably, I started my telehealth journey in 2020 as part of a major hospital system. And we had to pivot very quickly. And up until my last clinical spot last year, I was doing a hybrid program of in-person as well as telehealth for my patients, and it was a great experience. So I'm glad to be here.
Thanks so much. As you guys can tell, we have a great spread here. We've got PTs, we've got operators, we've got hiring managers, we've got recruiters. And I think trying to fill that gap, one, from traditional rehab or even traditional patient care to telehealth has its own challenges. But another challenge that we don't really think about is, what is the other side thinking? What are the hiring managers thinking? What are the managers thinking? What are the founders thinking? What are the operations assistants thinking, and things like that? So you've been in several different roles and several different systems. You've worked at major hospital systems. You're a professor. You're a senior medical advisor at a startup. I'd love to get your take on what it's like understanding the other side. What are some value propositions that are common sense to clinicians, but maybe not to non-clinicians? And kind of in that vein, why having clinicians in decision-making roles is super valuable in the telehealth space.
Absolutely. I think that when, I always come from an intersectional lens, from a social justice lens. And so when you look at it from that perspective, you want to have equity and you want to have as many brains in the decision-making role as possible. And so with our clinical expertise, I'm speaking as a PT, I've had the opportunity to be on both ends as a student, resident clinician, and then as a manager. And I think the primary value add is going to be accessibility. Accessibility is the way to go. That's one of the main processes we need to close the healthcare gap and the access gap to healthcare products, to the healthcare system, period, whether you're in tech or in clinical or surgical space or in the academic space. So access is going to be the huge value add, because when you have access, you have more people looking at your product, whether that product is your physical therapy intervention, whether that's your education proposal, or it's just changing the idea of how to take care of oneself. When you offer these additional ways to access care where you're not losing quality. And particularly from a PT perspective, I can speak to that closely because that's what I do. Particularly from a PT perspective, a lot of us, especially when we were shifting, where everyone had to shift in 2020, It was about, oh, am I giving the same quality? Is it going to be dropped? And the thing is, I think that we are all given the education to innovate, to grow, to develop, to evolve, to transition. And once you're able to get in that creative space, it actually not only benefits us, but it benefits our patients and society as a whole.
Thanks, UC. That makes so much sense, and definitely hear you what you're saying about access. I think implementing access itself is a challenge. Things we know as clinicians, such as you need a different license for every state you practice in, may not be common sense to people who haven't been in the clinical world. But really, things like that have lots of value, especially if you can speak multiple languages, especially if you're licensed in multiple states and things like that, which we'll get into in a little bit. But something I want to touch on first is, just like traditional healthcare settings, small clinics and big clinics and major hospital systems are all very, very different, both in what they expect and how they operate. And I'd love to get a chance to hear from Megan and James about the differences between small telehealth players and large telehealth players in terms of your expectations versus reality, and also the workflows you see as you're working across these companies. So Megan, why don't you go first? What was your experience like in terms of expectations and workflows across the different telehealth providers that you work for right now?
Right. Well, I've mostly been with early stage startups. So there is a lot of what I like to call hurry up and wait, which is kind of frustrating because you may get hired on, but maybe you need to be credentialed, which may take a number of months if that particular startup wants to go through insurance or maybe start a pilot program. Others are direct to consumer or DTC. Those actually go relatively quickly. So that's kind of like, all right, go, here's your patients. So then there have been, unfortunately, some other startups that I've been ghosted at, which I think is somewhat unfortunately a common thing these days, where you get hired on, you're on the platform, you're ready to go, and then absolutely nothing for months. And then you just kind of end up disconnecting yourself. So, it kind of varies, in the smaller startup world, kind of the newer startups, it can just be highly variable. So you just have to roll with the punches a little bit. So that would be maybe more of the reality of it. Now, as far as workflows are concerned, that can also be widely different. One of the more established companies that I do a majority of work with, Recovery One, they are very well established. They've been around for a number of years. Their workflows, very well established. Their onboarding and training programs for therapists coming onto the platform are very robust. But then kind of the very early stage startups, you're pretty much kind of at the mercy of, what is your background? What is your knowledge? Okay, roll with that. And then there's a lot of opportunity to help create those particular workflows, which I think is a very exciting thing and what draws me to continue to stay in like the early stage startup realm.
You bring up such great points. Something we say in the startup world all the time is you're literally building the plane as it's flying, right? Sometimes you have a pilot, sometimes you have the seats, but really you're just figuring it out as you go. I think that's really important because just like in the clinical world, a small new clinic is going to operate very, very differently from a national clinic or a major hospital system. And I'd love to hear from James. James, you work at an international major telehealth provider, right? With a bunch of products and a bunch of services. And I'll posit the same question to you. What are your differences in expectations versus reality? And could you kind of describe the workflows that you go through on a day-to-day basis?
Yeah, it's a great question. And it's funny to hear about us talked about as a big company, because when I joined, nobody knew who Sword was. I didn't know who Sword was. I mentioned earlier I found the company by accident, and it's very true. But now we want to be like the Nike logo for healthcare. And at first, it was building the plane as we fly it. For sure, I'll be the first to admit it. And we made a lot of mistakes, absolutely. But if we make 9 mistakes, but we have one really great idea in that among those mistakes, then we learn from it and we build on that. So I think it's really important to learn from your mistakes more than anything else. And then over the past 3.5 years or so, we're much bigger now. We just had one client in those early days, and now I think we're over 1,000 or something like that. I was employee number 40 or 50, and we're around 1,000 employees now. So it's been really interesting to see that transition over time. And how do we scale that? How do we provide care to as many people as possible without sacrificing the quality of the care? And I think it's reinvesting in your product and your employees. where can you implement AI? Where is it clinically safe to do that? And as far as workflows go, that's literally my job. You know, how do I take those learning lessons, both the good and the bad from those early days, and build on them, make a really robust training program, and by investing money in training, investing time in training, study after study shows that doing that pays off as far as employee retention, employee satisfaction, and so on. And I would say today we can train 25 physical therapists in the time it previously took to train 3, just even a year ago. So the investment is worth it. And I just want to touch upon accessibility too, because that's one thing that has stayed true to the mission from start to finish. It's creating accessibility to care. It's the way we offer our product allows patients to basically you don't have to deal with the high copays, the waiting lines, things like that. With digital health, we can expand into rural areas, and especially during COVID, when we hit the ground running, patients who would have had to drive 40 minutes to the nearest clinic, sit in a waiting room, get childcare for their kids, drive back. That's not to say digital health for everybody, but for those that it is appropriate for, we can reduce barriers, save money, save time, and improve accessibility to care. So no matter how small or big you are, you got to stay true to your mission, and that's what I'm always keeping in the back of my mind as we scale up.
I think that's super important. And I think it goes back to all of us. When we took our white coat ceremony, we could have done anything in the world, but we chose to be clinicians, to save lives and help people and help our communities. And now with the virtual movement, our communities got a lot bigger. But something that I thought that was really interesting, as I'm hearing, both Megan and James speak, is there's a lot of variability between small and big companies. And that's okay. Maybe you're a little bit less risk seeking, right? And you're looking for a more structured program. Maybe a bigger company with a more robust program and support would be better for you. Or let's say that you are someone who just wants to learn by doing and you're looking to build things as you go. Well, hey, a smaller, flatter organization might be a better option for you so that you can get more hands-on and learn horizontally versus vertically. But I think a lot of times when we hear, therapists or clinicians or anything like that trying to pivot, you try to box yourself into what you think you could be or should be. When really you have a lot of choice, and finding that fit for you is really, really important. And I think this is a really great background. And I just love to speak to Kiki for a little bit because, Kiki comes from an amazing background. She's the one who's helping hiring and source all of our clinicians for these roles. And I just love to ask you, what are the skills that you would expect for a telehealth role from the hiring side, maybe from a first hire who's never done telehealth before versus an experienced hire? And how would you approach that when you're trying to find the best fit for your company?
Yeah, so I feel like that's a great question in terms of like skills in telehealth versus not having any skills in telehealth. So I will start with having been experienced with telehealth. So when we're looking at I apologize if you guys hear background noise. When we're looking at candidates in the hiring pool, especially with Kaya Health, actually Kaya and Sword, we were competitors. So that was actually really interesting to hear about Sword. So I'm really happy that Sword's doing well. But with Kaya, when we looked for physical therapists and health coaches, a really big plus was having state licenses in multiple states because we wouldn't have to pay and onboard additional information with these physical therapists if they're already onboarded onto multiple states, they're verified in multiple states, and they are experienced in the telehealth platform versus a physical therapist that did not have additional licensures and weren't experienced on a telehealth platform. We wanted to make sure that we were really focused on having those PTs that had those multiple licenses and were experienced on a telehealth platform. In regards to PTs that didn't have experience in the telehealth platform, I think it was a matter of why are you pivoting into the telemedicine world? As Megan mentioned, there were times where she was onboarded and she didn't even get to start on the platform. And we really wanted to ensure that every hire we had were being utilized of their time. I have seen that where physicians at K Health were onboarded onto the platform, but were never scheduled to see patients. So it's just not a good investment of time or me. So I think really focusing and honing in on why are you pivoting into telehealth? What platforms have you used before? And are you versatile? Are you okay with jumping onto multiple projects? Because some startups are still building the plane as it's flying versus other startups are a bit more established. And you definitely see like the differences of some people may not be as successful in a startup that's just starting versus a startup that's a little bit more established with their workflows and their processes. So it's really important to ensure that even though we're not going to rule out the candidate that doesn't have telehealth experience, but we want to make sure that they are understanding that we don't have established processes or workflows like hospitals or clinics. So it's super important to ensure that they know the transparency of the role that they're jumping into.
I think that's great information, but there is a hidden gem in there that I just want to highlight. And especially if you're maybe new to the telehealth field, getting any step forward, any foot forward you can is super helpful. And what I heard was getting that dual state licensure is always a benefit, right? And finding that information is actually very straightforward. I mean, a lot of times you can go to a company's homepage and you can see where they're offering services in what states or what cities. And if that lines up with you, sometimes it's as easy as, paying $100 to get your license in another state and then applying to help give you a leg up. Right. So I just want to highlight that dual licensure strategy is not something I had heard until I had met Kiki, but it makes a lot of sense. Now, Kiki, I'm going to dig a little bit deeper into what you just said because I thought there was a lot of great nuggets in there. And specifically, I want to focus on, let's call them maybe first-time telehealth therapists. There's a lot of information online, great information on how to get into telehealth, certifications, multi-state licensure, bilingual courses, etc. But what's really challenging is when you have this flood of information, how do you prioritize what is most likely to help you get that job? So for you, when you were looking for candidates, certifications, do they even matter? Board certifications, OCS, SCS, GCS, et cetera. How did you weigh them? Multi-state licensure, bilingual, things like that. How would you prioritize, roughly speaking, from most attractive to least attractive when you were evaluating a telehealth candidate?
Oh, that was a great question. And it actually broke my heart because there were so many physical therapists and health coaches that did apply when I was working at Kaya. And I think the main skill set that, especially for a startup like us, we weren't early, but we weren't later. We were right in the middle. Really having that board certification, really having the multi-state licensure, being bilingual, and having at least 4 to 5 years of experience in, it doesn't even have to be telemedicine world, in the PT world. So for us, that was our qualifications. But I know there's other companies that want those like entry level grads. It's just a matter of finding those companies. Unfortunately, with the startup world, it's very hit or miss. But yeah, having those years of experience, multi-state state licensure, being bilingual, and maybe even having some experience with operations helps immensely as well. But it's a matter of what the hiring manager at that moment of time is looking for. So it's very hit or miss with every company you go with. And it's unfortunate that it's like that. But I think we're eventually transitioning into less years of experience just because there's a lot of people that are graduating PT school that are transitioning into the telemedicine world just because it's so flexible and it works with your schedule. It's a good balance. So I don't know.
Yeah.
I hope that answered your question.
Absolutely. It varies, and there's a ton of free resources out there based on if you find a company that's looking for these certifications. MedBridge has a free telehealth certification program. I think the APGA's telehealth program is like $100 or something like that. So definitely finding that combination of getting that experience and these resources while doing your research on these companies and talking to people who work in these companies seems like a great plan moving forward. I want to jump to Megan real quick, just because Megan, like I said, you've worked across several telehealth companies, especially like newer entrants, maybe that were a little bit less organized or working towards those steps. And, in your experience, what were some tips for transitioning from in-person to telehealth? Less so much from the actual clinical care side, but more so maybe the tools or the tech or even just the way to carry yourself or organize your thoughts or organize your actions.
Yeah, I definitely think you have to be a well-organized person going into the mix, even though there's a lot of variability and you have to be very flexible because things can change quite quickly. I think just really having the experience and not to like be not to negate anything that Kiki just said, but I actually feel that experience is, not just more than being out of school a couple of years. I feel like, I look at myself and think, God, I would have been horrible at this if even 5 to 10 years out of PT school. So ultimately, not to slam new grads or anything, but, I think you have to have the experience that comes with, just being in the clinic for years, pattern recognition, patience, communication techniques, just the overall confidence to kind of know that what you're doing is right, even if it's something that is out of your wheelhouse. It could be from technology, or it could be just, again, kind of starting from, doing the 0 to 1, starting with very little product and then trying to help flesh out the product as time goes on. So ultimately it's kind of a diverse skill set. So not to, sway anyone from not going into telehealth, because I can tell you all the things that I absolutely love about it. And I know we'll probably get to that a little bit later, but I do think it does require a specific type of person to jump into at least like maybe the less defined roles, the ones that I've been part of. And I think, as you guys alluded to, a little bit ago, those that are maybe newer grads or, not quite as comfortable with just those, undefined roles should kind of look towards more of like, your bigger box companies, because they're going to have more of their policies and procedures in place and there's going to be less questions, and you'll be able to start to get the experience that you need and kind of define your role from there.
Absolutely. That makes sense. I know just for me, like I went the residency fellowship route and I did a manual therapy fellowship, way back when the dinosaurs roamed. And I just imagine, even with that experience, telehealth would probably have been twice as difficult for me because I was more used to using my hands, right? Where when you're in a digital first environment, the game is totally different. It's definitely good to invest in your skills, both clinically and non-clinically, and being able to solve lots of problems, lots of different ways, right? And being able to use the tools to get there. And, I want to go to James real quick. James is such an interesting guy for multiple reasons, but you were an early employee at Sword. Now you're responsible not only for treating, but for training and enabling clinicians to take care of patients to fulfill your mission. So I want to posit the same question to you, maybe on the training and enablement side first, right? In your opinion, what are tools that you see your clinicians either need to know before they go in versus they have time to build up familiarity with after they've been onboarded onto your company?
Yeah, I could give you a whole list of tools we use on a daily basis, but I'll keep it simple. And as far as the tools to really have down, but before you enter a digital health role or really any startup role, Slack is I describe it as AOL Instant Messenger for those of who grew up with that for professionals. It is an instant messaging tool that a lot of companies use. Some use Microsoft Teams, I think too. But it's the best way to stay engaged with your colleagues, and it creates a sense of connection with colleagues who you don't get to see very often. So it's just as important for important updates as it is just to keep each other laughing, because you don't get those lunch, you don't get to go eat lunch with your colleagues anymore. So familiarize yourself with Slack, even if you don't have an account. Read up on it and see how it works. If you can come in day one knowing how to use it, you'll be off to a better start than your colleagues starting on that day. The Google Meet and the Google ecosystem as a whole, Google Calendar, Gmail, and so on, they're intentionally made to be easy to use, right? Anyone can, most of us could open up anything on Google and at least learn the basics. But you can go down roads with all those tools as much as you want to. So really familiarizing yourself, not just how to use them, but all the features available within those tools. Once again, I think a lot of companies in this space are defaulting to the Google ecosystem. So if you're not already familiar with it, that would be a great idea. And then Zoom, of course, as everyone knows Zoom now, not just how to use it, but etiquette, for sure. You don't want to go into your first meeting on day one, not have your microphone muted, and someone comes into the room or the baby's screaming. That's not the best first impression to the company. So kind of there's a lot of resources, YouTube and so on, for Zoom etiquette. And I recommend, if you're not familiar with Zoom in a professional setting, to read those. And then outside of the tools, I cannot stress the importance of a good home office enough. Of course, for your physical well-being, as physical therapists, we're biased on that. I was working for Sword for about 8 weeks before I went and bought a standing desk because I had neck pain I never knew existed. I could finally say to my patients, I know how you feel. But it's very different than going from floor to floor in a hospital or from table to table in the clinic. You are in one place and you feel it for sure. So it's important for our physical health, but it's really important for our efficiency too. So, I have my screen over here with my ring light to make myself a little bit brighter. Having, working here, having my notes over there, figuring out your optimal work setup that works for you, because everybody's different, making sure you're comfortable. If you're comfortable, you're going to work. If you're more comfortable doing work, I think you're going to do better work. And it pays off. It's worth the investment to have a great home office setup, both for your physical health and for your efficiency, especially in your first few weeks at a new startup.
I think that makes a lot of sense. In clinic, we're very into personal hygiene. You clip your fingernails because if you're touching patients, you don't want to be digging on them. You don't want to wear ties because they attract germs. But also this digital hygiene is so important because first impressions really help build that patient's trust, right? And being able to see you, knowing that you're in command of the situation, all those go a long way in this digital patient care realm to help create trust and to help patients get to those end goals that you want to help them get to as well. I also want to take this chance to introduce a word that you might be familiar with, which is called a tech stack. All a tech stack is, for people who don't know, is a term that companies use for the tools, the digital tools that help run their company. So, for example, some stack tools that James just mentioned would be Slack, which I also highly recommend. Even use it in your daytime. You can do fun things like make your own emojis, so you can have all your friends on it, and it's great for going to that digital first work environment. The Google Suite, Sheets, Google Docs, etc. What you'll find is that the smaller companies will tend to use the Google Suite, whereas the larger companies will tend to use the Microsoft Suite. And a lot of that has to do with pricing and scalability. When you're a startup, you don't have much money to spend. You're going to go with something that's a little bit cheaper up front, whereas the larger companies will go for these contracts with Microsoft just because everyone in their company will know how to use them, considering they probably have employees that run from age 20 to age 60. So really, that's kind of an interesting thing. The size of your company could also dictate what tools are most likely to use. And then finally, Zoom. Zoom is so important. Just like James said, there's so many great free resources out there on YouTube and free guides about Zoom. But even simple things, like having the camera at eye level is super important because, when you're working with patients, you want to be able to look them in the eye and speak to them. And the digital way has great value as well, but you want to make sure you're communicating that in the sense you're going digital first. And you notice I'm saying the word communication a lot, right? And I want to pivot over to UC a little bit, just because UC, you've been through so many places, professor, early stage hospital adopter, professor, et cetera. This idea of communicating value, both with other clinicians, with patients, with non-clinicians, with practice managers, is really, really challenging on its own right. But even more so in the digital age when, like James said, you're not at the water cooler or grabbing lunch or things like that. So UC, across all of your experiences, how would you recommend communicating to different parties about your value as a potential hire and as a trusted employee?
Well, I think first off, it's to understand that what the company is looking for, what their values are, and what their goals and their compass is. As I think individual professionals, we also need to really understand where we sit in our own value and what we're bringing to the table. But then what I do beforehand is to say, okay, here's what I'm bringing to the table and here's what they need. Is that a match? And understanding that that might evolve over time. But then when you have those opportunities to have a seat at the table, you state, hey, this is what I'm bringing to the table. This is what I can do for you. And I want to stay at this table so that I can build this process, build this department, build this line of, clinical pathway or academic pathway or however pathway you want to create. I want to be the champion of that. And this is what I need in order to put this forth. And so for me, as a practice, even when I was a student, I always knew what I brought to the table, but I also knew what I wanted to learn. And I knew that what gaps I needed to fill, and I wanted people to help me fill those gaps. And so I took that practice and I kept that throughout my career. And that's why I've been navigating in like academic medicine. So, this is my first year in a PT as a faculty member in a PT department. I've been in med schools on faculty my whole career, which is wild because you're like, what is a physical therapist doing in med school? But That's how it worked. And then I was consulting with all these tech startups and sex tech companies. And so and I kept going into that practice of saying, okay, what are your goals? And then here's what I'm bringing to my table. Here are my expertise. Here's how I can solve this problem for you. And does that fit? And if it doesn't fit, that's fine. Then, I would pivot or transition away. But if it does fit and we're able to work together, then we would grow together, not as me separately and them separately, but together in this common goal.
I think that's so important. And I want to just pause and dig into that a little bit, because for people that don't know, UC is a women's health board certified therapist. She's a certified sex counselor. She's a professor at med schools and PT schools. She's a senior medical advisor at women's health startups. Like she's very deep and very broad in terms of her experience and knowledge base, right? And something I want to ask you is kind of, you're a deep subject matter expert, right? Like you literally trained people and wrote the book on women's health and sex counseling and things like that, right? As well as training clinicians, right? And were there any challenges you had in kind of translating that deep knowledge, even for specialized companies, to some of these people who maybe were not as well informed on these deep medical topics?
So that's a fantastic question. And I will tell you this. One of the things that really helped me navigate that is that I would go to our conferences. I would go to the PT conferences, but I would go to conferences like South by Southwest or Fast Company or, Afrotech. I would go to all of these different tech conferences that were in the tech space, were in the healthcare space, because I think a lot of times we think we only want to go to the combined section meeting as physical therapists. But I had to, because I had roles and I was on the board at the Academy of Pelvic Health, I needed to learn how to manage. I needed to learn how to think, expand. And so I always put myself in situations where it wasn't just 1,000 other PTs, it was 1,000 people in different spaces with a common healthcare goal. And so I started to understand the language, the mindset, and would marry it with my mindset. But yeah, there were times where I would, express, hey, this is how we approach things with a common goal. And I would come up with resistance, particularly in the beginning of my career when I started working in med school spaces. But at the time, the challenge wasn't necessarily that they didn't value, it's that they didn't understand where I was coming from, because they were trained this way, we were trained this way, and none of us were given the interprofessional skills. And so we had to work together. And so I think for me, I always held steadfast in what I knew and what I valued, and understanding that they were trained a certain way, I was trained a certain way, and then understanding that we need to establish a new common language for each other because we actually do have a common goal. So for me, I would always lean into curiosity and say, so we're having this deficit here. Here's where we're falling short. I really want to understand from your perspective, where is that coming from? And I would ask. And I think I was just happened to be in places where my colleagues had the same commitment to solving that problem. So we would lean in together. But I would never retreat. Mm-hmm. I would never retreat and say, oh gosh, this isn't a good fit, this doesn't work. No, I would just make sure I learned and understood what the problem was, why we weren't connecting. And then I would say, oh, okay, so this is why we're having that. So this is how we were trained as physios and PTs. And this is how we think about this process. And this is the time frame in which we have to do it. Right? Or we have a different budget than you. Things like that. And so we would have to kind of go through the basics and understand each other in that aspect. And then once we understood those logistics, right? Once we understood, okay, here's how much money we want to make this quarter. Here's what we want to do with this. Here's how much money Medicaid, Medicare are paying us. This is the reimbursement, all of that stuff. Then we would start to understand, okay, this is the flow we need. Absolutely. In addition to the value, in addition to the accessibility, right? How are we categorizing those things?
I think that's fascinating. You're talking about building bridges, but you're also building bridges within the medical community, right? As well as with the tech community by going to these tech conferences and other conventions and things like that. And it really is a great point. You can't really build bridges until you learn more about how the other side thinks about and approaches problems. And your strategy of learning from professions outside of PT, like the tech guys, like the physicians, like et cetera, to build those bridges really helps show our value as well. We're all trying to work towards a common goal, which is better patient care, better access, and things like that. And so let's take a step back and let's kind of think about this discussion we've had so far. We've gone over the landscape of telehealth, and we've talked about the differences between small companies and big companies. We've talked about ways to make yourself attractive, whether you're a new hire to telehealth or an experienced hire to telehealth. Things like showing your language skills or getting licensed in multiple states. Things like learning how to use the tools, the tech stack, and really how to communicate and create bridges. As we move through this cycle of going into the telehealth world, I think now might be a good time to talk about the day in the life and what the actual day-to-day looks like, right? And let's take a second and talk a little bit less about patient care and more about what you as a therapist or a clinician go through on your day-to-day workflow. So I'll go back to Megan again. Megan, we're going to call all these different companies. What does your day-to-day look like typically? And what are the non-clinical things that you're expected to do? And how long would you say they take?
Well, my days vary considerably. I consult with a lot of different early stage startups in addition to having kind of a broad patient load with Recovery One. So I have kind of definitive timeframes where I'm doing specific things for specific companies. And then typically, like at the end of my day, I have a dedicated set block of hours for Recovery One to see clients, to place them on their exercise pathways, and do some remote therapeutic monitoring as well. With the early stage startups, it's very asynchronous. You may have I just had someone grab me right before this call for like 10 minutes to, just go over a couple of quick things, what we're looking to accomplish over the next couple of weeks over the holidays, and to kind of get our game plan going. So ultimately, every day is a little bit different for me, which I actually like after being in the clinic for so long and doing what I felt like was the same thing over and over and over again. The variety is actually the spice of life for me. Non-clinically, I'm going to be sitting in on meetings and collaborating with, product marketing founders, VCs, working with other therapists if they, have other therapists on board to define best practices or to work on like workflows, more clinically based applications. And then remote therapeutic monitoring just in general, because there is patient care involved with most of these companies as well. So not only are you seeing the client or the patient, but then you're also following up with them on a week in, week out basis. So, remote therapeutic monitoring, just checking in, monitoring home exercise program and compliance, things of that nature. So there's a lot of things that are very similar, but then there's, again, kind of more the non-clinical aspects that, again, kind of give me a bit more variety in my day.
So I'm just listening to this, I'm using my clinical brain, and it was like, there's a bunch of words in there that I never encountered during clinic. And it's like, it just goes to show that clinicians can do anything. You can learn a lot, you can implement, you can change what you know, and you can ultimately still serve your goal of treating patients. But something I'd like to ask you as a follow-up to that is, it's a big learning curve, right? And how did you deal with maybe the imposter syndrome, or even when lots of clinicians reach out to you about getting into telehealth? What advice would you give in terms of that imposter syndrome? Because it is a lot, but it's totally doable.
I don't have great advice because I still struggle with it daily, hourly, minutely, whatever you want to say. I would say the biggest thing is just, and again, maybe it's from experience and being in the game for a while, but like, just throw yourself in there. I always, and even, going back to my early days as a PT and working with my higher ups and mentors, I say this jokingly, so no one freak out, but I always say I'm the stupidest person in the room. And then I'm going to learn from each person. I have little bits and pieces that I would take away from various mentors or therapists that I'd work with over time. And I would always joke, well, I'm going to steal that treatment. I'm going to steal that exercise. That's totally awesome. But I use the same mindset when it comes to working with, different collaborators within the health tech startup world, because I know nothing from like the tech end of things. I'm just now starting to throw out some terms that my husband, who's in tech, will be like, wait, did you just say that word? So it comes with the territory and you learn over time. But I will be perfectly honest. I can't create anything from a tech perspective, but I can learn from, the co-founders or from the product team, even from like success managers and things like that. I'm constantly learning, which again is the big draw to a lot of these early stage startups, because I don't want to do the same thing over and over and over again.
I think that's some great points. It's okay to be afraid of it, but just because you're afraid of it doesn't mean it stops you from learning about it, right? Because we all had to take that first step at some point, right? And I think that's just a great point you just made. So let's switch gears. Let's go to James. Again, much bigger company, also in this unique perspective where you're not only training and treating, but you're also managing and leading, right? And for you, let's talk about some of the other metrics that we may have heard about in clinic that may be a little bit different, both in terms of definition and interpretation in digital health. Things like productivity. What do hires you see who thrive early on? What are they doing differently versus the people who may struggle a little bit more? What tips would you give on those, as well as how to make that transition?
Sure. Our productivity metrics, and I'm really proud of this, are tied to clinical outcomes. So we have a strong clinical research team. We have a lot of data coming in, and a lot of clinically gold standard outcome measures that we get results for every one of our members that goes through the program. And we use that data in lots of ways, but we tie it to PT performance metrics. We think our PTs should be evaluated on being good PTs at the end of the day, for sure. So what that means, how do you get there? It's getting our patients over the finish line. It's getting them to commit to essentially an exercise program. Our niche is, of course, patients who don't need in-person care. Good in-person clinics are our allies at SORT. We focus on chronic pain that can be mostly solved with just exercise. So that's where we focus, and we funnel and refer out when necessary, of course. With that comes a challenge though, right? We're doing video calls. We have technology that tracks objective measures much better than I could with my goniometer, I will admit, and my old CIs would probably tell you the same. So I'm grateful for our tech too. But what makes a good PT here is the ability to use your ears a lot more than you got to use your eyes a little bit, but a lot more than your hands. And what I've learned in the past 3.5 years, I could have been a lot better listener before I worked at SORT. I can think back to all the patients where it didn't matter what objective test I did on day one or what outcome measure. If I just listened to them for an hour and built their trust, I could have done so much more. So we really focus on that aspect of it, motivational interviewing. We hire, just like Kiki was saying earlier, we have similar standards. We only hire PTs with at least 3 years experience and so on. So we know we're hiring good PTs. We have a ton of applicants coming in. So we're not worried about the clinical quality of our candidates, but how good are we at listening? How good are we at meeting members where they are, meeting patients where they are, and having goals that make sense? So that's where we really focus on our efforts to hit those metrics. To answer your question, I think you got to look at it two ways. How can you be successful with patients? How can you be successful with employees? And I've noticed one thing that the most successful colleagues I've had here, one common thread, it's the ability to see problems as, to see challenges as potential opportunities. So when problems come up, which they do in this world all the time, because we're building the plane as we fly it, like we said, it's easy to get down. It's easy to get frustrated when problems happen. But if you step back and look at, okay, we had this problem, it didn't work right this time. What can we learn from this? How can we move it forward? I've noticed that sense of ownership and taking that problem, turning it into something positive. My colleagues who've been here the whole time with me have experienced that. The ones who have left, really didn't approach things that way. So I think with patients, how can we motivate and use our ears? With our colleagues, how can we see problems as potential opportunities? And then I guess the last thing, as far as, maybe who wouldn't be successful in a digital health role, it's maybe someone who gets too stuck in routine. Things change so fast in this world. There's not a lot of precedent. So you got to adapt to change and be willing to go with the flow. If you're someone that, really likes that routine and structure, and, sees potential changes as something to resist, maybe you won't be successful here. But if you see those potential changes as something to embrace, learn from, and move forward, I think that's going to make a successful clinician in this environment.
I think that is a huge factor. Something to really think about as we think about how healthcare is changing, right? Because a lot of us in the clinical world are perfectionists, right? And we demand perfection from ourselves because of our white coat oath, do no harm, right? We're so afraid of doing the wrong thing, of potentially hurting a patient, that we need to be perfect, right? But in this digital world where the tools are changing, right? Not necessarily the goal of patient care, and you have these strong guardrails like outcomes-based reimbursement and things like that. It's okay to be a little imperfect. In fact, using those imperfections to find an even better way to do things is something that is maybe a little bit different than what we notice in the traditional clinical world, but it's something that's changing as we move forward into this telehealth ecosystem. Would you agree?
100%. Yeah, couldn't agree more, John.
Cool. We have a question in the chat right now. I'll just stop and read that out really quick. Question: how would you suggest approaching companies where the contributions can be broad and strategic? I'll actually split this up amongst two people. We'll go to UC first, both from the senior level, and then from Megan coming in from the bottoms up level. How would you address this question? How would you suggest approaching companies where the contributions can be both broad and strategic?
Do you mean just approaching to collaborate to is that what the
Yes.
Okay. Yeah, so I would think about so I'll tell you how I did it. I don't know if that's the best
That's
way.
the best way.
But I actually would just write out like what am I bringing to the table. I in my entire career, everything was intentional, even though I like for people to think that it wasn't. But everything was highly intentional in terms of doing pelvic health, doing the sexual health component. I niched myself down so much so that I could really focus on what I really loved and I knew could serve the community. And then I would look at the ethos of the company and I would pick companies that were alignment and ethos and what I was trying to do. And then I would reach out and say, hi, my name's Uchenna Osai. This is what I've done. This is what I would like to do. And I see that this is an opportunity for us to collaborate and actually add to what you're already looking to look at. Another thing that I would do too is I would ask around my friends who were in different spaces in marketing, in entrepreneurship, in venture capital. I would ask them like, do you know this company? Do you know these people? Tell me a little bit, give me some background. And that's why it's really important to go to those conferences and network with those people and handshake, because you never know who you're going to meet and they would give you ideas. And sometimes I would just watch people network because I didn't have that opportunity in PT school. I would just watch. I would just sit in the corner, drink my coffee, and just watch people talk and how they would connect one another. And I would do that. So I would do the cold email, or I might have a friend introduce me via LinkedIn, and then I would approach them that way. I have a media kit. Some people do have that. Some people don't. You don't necessarily need that. You could actually use your CV or resume as like a way to kind of highlight the hot spots in a quick way, especially in this digital age. I actually do think that, particularly PTs can actually do something like this and taking your experiences and say, this is how I can bring this to the table. Every single one of us have the ability and skill after you've been practicing it, even for 6 months or a year, to be in an advisory role. Mm-hmm. And really kind of starting with that, having a little bit of swagger and saying like, I can, and you can lead them by telling them what you want to do. Like, I would love to be an advisor on your team because of X, Y, and Z. Or I'd love the opportunity to meet with you and talk about potential collaboration as a clinical or health advisor. And here's what I'd like to see in the next year and how I can help you. And here's how we can divvy that out.
Yeah, that's a great add-on to your previous comment about networking outside of your circle in terms of conventions and things like that. Like, you got to remember, you went to school for like 7, 8, 9, 10 years. Like, you guys are doctors and nurses and clinicians. Like, you have a lot in your brain. Like, you can go up there And you don't have to be egotistical, but you know things that they don't, right? And being able to find that common ground, I think, is super important when you're reaching out to companies. Megan, do you have any thoughts about this question? About reaching out to companies about contributing even beyond just the patient care side?
Yeah, my I think my first one was somewhat serendipitous because I got a random email just saying, hey, we're a physical therapy company where we treat runners. If you're a runner that has pain, come and see us, virtual visits. And so I clicked on the Google form, filled it out, but at the very end when it said describe your injury, I was like, I don't have an injury. I'm a PT, I'm an endurance athlete, I'm a coach, and I want to work for you. Let's talk. And I left it at that. And literally 5 minutes later, the founder called me. So yeah, it's kind of like I said, that one was kind of fell into my lap. But ultimately, after that, I was able to update my LinkedIn and say, hey, this is what I was doing. I was consulting. I was working on X, Y, and Z. A little bit of that 0 to 1 lingo. I was learning a lot, so I was able to really parlay that into other connections. And then I got hooked up with the couple different LinkedIn groups, and of course that has broadened my connections substantially, and that has led to other opportunities. So much like UC said, the networking is priceless. Trying to kind of beef up your LinkedIn community is super helpful. Finding different groups to belong to, like I'm part of a group called the Clinician Transition, about clinicians moving to other roles other than clinical type roles. And so they've had great community content about various types of roles, but then also posting jobs, connecting people that are in various, different aspects of like the startup world. So that's invaluable to me. But yeah, sometimes it's luck, and then other times you really got to work for it. But I've had kind of everything across the spectrum.
Definitely +1 for TCT. They're great. Something I do want to touch upon that UC and Megan both touched on is you have to have a LinkedIn. And it's not so much for you to connect with each other, which is great, but because this is how companies find you. And the reason why is all the recruiting software that all these companies use automatically pushes to LinkedIn for their job posts. So that's how they kind of search for candidates, right? So you got to have a LinkedIn so people can find you, right? And a great hack for conventions is once you have a LinkedIn, you can actually just set your home screen as your QR code, which means whenever you meet someone, you just show them the QR code, and now you're connected to make those moments of serendipity later on, just like UC mentioned. And another thing I want to mention is in terms of reaching out to companies for opportunities to contribute, this is actually a great time and great place to reach out to small companies, because a lot of times the small companies will still have the founders or the managers who are answering the emails to the website. And the way you do this is you just go to Google and you type in pre-seed musculoskeletal startups, or seed stage musculoskeletal startups, or seed stage women startups. And Google will do all the work for you. You go to the website, you see if you like them, you reach out via the contact page. Usually what I found is if you have a pretty good value proposition, understanding the company, about 30 to 50% of those companies will get back to you with at least an email. And that's kind of your way in. So really think about those smaller companies, your value proposition, and your networking to create moments of serendipity. Now we're running short on time, and I want to get to the big elephant in the room question that I know we're all thinking about in our careers, which is career progression. And I want to give Kiki the floor real quick, because from your side, as someone who sources and places candidates, how do you see advancement opportunities and career paths in the telehealth field?
That's a great question. It honestly varies per company and how their funding is looking like. So I know sometimes there are PTs that I hired that they ask, hey, can you pay for my recertification or my renewal for my licenses? We were fortunate at Kaya that we were able to do that, but other companies are not as fortunate. So it really depends on how early stage of a startup it is versus a startup that has established processes, established hiring teams, established people ops teams. So I'm really big on, if we don't have the funds to sponsor for license renewals or education CMEs, we should really be big on career growth and progression. So it varies per startup. Again, some startups, they have their biannual performance reviews where in 6 months you're eligible for a promotion or eligible for a leveling up, versus some startups do promotions once a year. So it's a fine balance of either we offer CMEs, or if we don't offer CMEs, how can we reward this employee for being in our company? So I hope that answers your question.
Super, super helpful. And I'm going to give James the last question, right? James, you've been in it. Early employee, big company now, promoted through the company, doing great things, making a bigger impact in both your digital and native communities. What was that jump like from you from a PT into a leadership position? How did you manage that? What was that journey like? What tips would you give in regards to your own experiences?
Just on, let's say our viewers get in the door, stay curious, ask questions from the start. Those organizational charts, pyramids, trees, whatever, they exist, but they don't, it's not like the brick and mortar world. Everyone is so much more approachable in this environment. In that first week, I reach out to our product team, our engineers, our chief medical officer, set up 15 minutes, get to know them. And as a result of that, on a daily basis, I work with pretty much every team at our company. I've had 3 titles, but like 100 different jobs here. Some days I forget what my title is. I have to have one, so I do. But yeah, if you ask questions, stay curious, and aren't afraid to get to know your colleagues across departments, you can grow infinitely along with a company that has a good trajectory. So I got lucky. I had that mindset, and I was working for the company that was on the right path. So those 2 things aligned really well. You need both to happen, but you can do everything in your power to make it happen. So stay curious would be my number 1 advice.
Great. Well, guys, I know we're at time. Thank you so much for donating your time to the restaurant clinical community to talk about telehealth careers, both how to set yourself up, how to find a good company, how to create value, how to set yourself up for that interview, what a career progression looks like, and just how to network and keep growing into this evolving healthcare landscape. That's all we've got for today. If you have any other questions, feel free to shoot us a message on the Next Degree LinkedIn. We'll do our best to answer it and get to the right people. And above all, let's shape the future of healthcare together. Thank you guys so much.